By now, you are likely scheduled for surgery, and Laura, our surgery scheduler, has reached out to you to pick a date for your procedure, scheduled your CT scan for the My Knee protocol as well. She will also obtain approval for the surgery from your insurance company and supply you with the orders to take to your primary care physician for your pre-op physical. Leading up to your surgery day, we require that you be evaluated by your primary care physician with a preoperative EKG, blood work, and overall evaluation to ensure it is safe for you to proceed with your knee replacement surgery. We require this to be completed within 30 days of your surgery date. If it's outside of that time, we may request that you do it again. Unlikely, but it's possible we'd need to postpone your surgery if we just can't get it done. If you see a specialist such as a cardiologist, pulmonologist, hematologist, we really need you to obtain medical clearance from them as well. If you're a diabetic, your hemoglobin A1C, which is a marker of your long-term overall diabetic control, it needs to be 7.0 or less. If not, your surgery will likely need to be postponed until this is achieved. Poor diabetic control shows a significant increased risk of wound healing issues and infection in your new total knee. Similarly, patients with a BMI, which is a calculation of your height and weight, that is over 40 has also shown to have increased risk of infection as well as other perioperative complications. If you are a smoker, you need to quit for 6 weeks before and 6 weeks after your surgery, as smoking and nicotine use significantly increases your risk of wound healing issues and blood clots. Remember, we want you in the best shape as possible going into this shared commitment. For details regarding the procedure, please refer to Dr. Lauk's video regarding total knee replacement design and technique. However, as a refresher, here's what your new knee is going to look like. As a reminder, we're not simply lopping off the ends of the bones and gluing on a chunk of steel on the end. We're taking small wafer cuts off the ends of the bone, as you can see here, and then we're resurfacing it with the metal end caps. You have a plastic spacer in between the two pieces of metal, and that becomes your new joint bearing surface. Also, though it's not pictured on this model, as far as your kneecap goes, we do take a small wafer cut off the back side of your kneecap and then resurface it with a specially designed plastic button. In this section, we'll cover medications that we want you to stop before surgery. In general, we want you to stop any medications that are going to thin the blood. This is going to include ibuprofen, Advil, Motrin, Aleve, Celebrex, Meloxicam, aspirin, or any other potential blood thinning medications. We want you to stop those at least 7 to 10 days prior to surgery unless you've been told otherwise. We also request that you stop all vitamins and supplements for 7 to 10 days as well, as some of these can also thin the blood. If you're on any rheumatologic or autoimmune drugs, these may also need to be stopped anywhere from 1 to 2 weeks before and 1 to 2 weeks after surgery, depending on the medication. We want you to consult with us as well as your rheumatologist to discuss this. You can continue taking Tylenol, which is also acetaminophen, or any other narcotic medications if you absolutely need those coming into surgery, as these do not thin the blood. In this section, we're going to cover preoperative infection prevention. Our goal for you is to have an uneventful, smooth surgery and easy recovery. One of the risks of having surgery is infection. We do take this very seriously. To minimize your risk of infection, we recommend a prescription nasal ointment that will help decrease the amount of bacteria that live in your nose. You will use this twice a day for 5 days leading up to the days before surgery. We can give you the prescription, or we can even call it in for you. We also recommend a special antimicrobial wash or wipes that will help cleanse your body of the bacteria as well. You're going to use this for 5 days prior to surgery. You can buy Hibiclens soap, which comes in a little bottle from the first aid section of your grocery store or pharmacy. If your surgery is at the hospital will also give you the Hibiclens wipes instead of the soap. We can provide you with the instructions on how to bathe with the Hibiclens, and we can provide you instructions on the nasal ointment as well. On the day of surgery, you're also going to receive routine preoperative IV antibiotics. Please notify us if you develop a cold, fever, rash, or other illness in the weeks leading up to surgery. Quick bit about dental work. We suggest that you have any non-urgent dental work completed at least 6 weeks prior to your surgery, and we want you to wait until about 2 to 3 months afterwards as well. Quick bit about home preparation. You should think about preparing your home by doing some laundry ahead of time. Additionally, we want you to prepare, freeze some meals, make arrangements for pets, and minimize the tripping hazards around your home.